morning. This is Warren Alston with you this morning at Stokes Farnham Insurance Agency in Travelers Rest, South Carolina. This is our second installment on our Medicare Monday series, and I want to go over today some information about Medicare Supplements. Medicare Supplements, also known as Medigap policies. And what they're intended to do is pick up where Medicare leaves off and offer some level of coverage for those charges that Medicare doesn't cover. Generally speaking, Medicare Parts A and B are going to pay about 75 to 80% of the charges that you would have as a senior citizen on Medicare, or a Medicare beneficiary if you're under 65. Anyway, those charges are going to be 75 to 80%, and the beneficiary is responsible for anything that's left over. So a $1,000 charge at the doctor's office is going to be paid somewhere between $750 and $800 by Medicare. That other $200 is going to be your responsibility or the beneficiary's responsibility to pay. Where a Medicare supplement is going to come in is it's going to come in and it's going to pay part, or in some cases all, of those charges that Medicare does not pay. So there are a number of different Medicare plans that are available out there. I'm going to be working off of the Medicare and You book from 2024. This is brand new one. Just got it in. And in the book, and I'm on page 76 here, it gives us about 10 different plans that are available. A, B, C, D, F, G, K, L, M, and N. Now, I've been in this business since 2008, selling Medicare, mostly Medicare supplements. In all of those years, 15 years, the only kind of Medicare supplements that I have ever sold is Plan F, Plan G, Plan N. So that's it. Those three supplements. Generally and widely known is Plan F. Okay? So Plan F is in Frank. Plan F is going to pay everything that Medicare does not pay. Now keep in mind, Medicare determines what it is going to pay and isn't going to pay. So if there's some procedure that you're having done or trying to get done at a doctor's office or a hospital or whatever it is, and it's just something that Medicare does not cover, then if Medicare doesn't pay it, there's no Medicare supplement that's going to pay it either. So these supplements are intended to supplement Medicare approved charges. And these also, all of these Medicare supplements are widely accepted anywhere in the country that accepts Medicare. So wherever you're traveling, it doesn't matter. The only thing that you need to be aware of when you're going for health care away from home is to make sure they accept Medicare. And if they accept Medicare, they're going to accept your Medicare supplement. You really have no travel restrictions. And it will even, in some cases, give you coverage whenever you're traveling outside the country. Generally with those plans, the coverage is going to be limited to about $50,000, and that is, of course, intended to get you stabilized and back in the country as quickly as possible. So, all these plans are standardized. They're considered and called standardized plans. And when we say standardized, we mean that all Plan Fs are the same. So there are a lot of companies out there. I don't know a lot. How do we define a lot? There are quite a number of companies out there that sell Medicare supplements, okay? And they all have different premiums for that Plan F. But the But Plan F, regardless of where you get it from, the Plan F is all the same. Everybody has the same Plan F. So you won't get a good Plan F here and a not so good Plan F here, because they all are required by the government to be standardized or to do the same thing. Okay? But it's really similar to getting a 2-liter bottle of Coca-Cola and going to the different grocery stores and shopping for that 2-liter bottle of Coke. Chances are every grocery store you get to may have that Coke at a different price, but it's still the same 2-liter bottle of Coke wherever you get it from. That's a good example of standardized. Okay, so Plan F though is noteworthy. It's been phased out, so anyone that's born before January 1st of 1955, those are the only people who would have access to Plan F. Okay. Plan F pays everything generally that Medicare does not pay. So if you have Plan F and you're born before January 1st of 55 and you want it, you can get it. And essentially, you won't be paying any copays, any deductibles, any coinsurance. When you go to the doctor, you won't be spending any money. So your money being spent is going to be on that Plan F premium. If you take that and multiply that times 12, or your annual cost for that, and you multiply your Part B premium and your drug premium, and we'll talk about that later, but that's pretty much your cost in a box. No matter what happens to you and your health, you'll know that with Plan F, what you spend on those premiums are going to be the most that you're going to spend for your health care. And some people like that. They like not having to write checks or use charge cards or do anything like that whenever they go see a doctor. So Plan F is a widely known for many years, a very popular plan. The downside to it is that unless you're born before January 1st of 55, you cannot get it. The next closest plan to Plan F is Plan G, as in golf. Okay, so G is close to F. G is going to pay everything except the Part B deductible. Now remember, Part B, let's see if I have one of my old notes. Yeah, Part B is everything Medicare that happens in doctor's offices and outside of hospitals, x-rays, blood work, things of that sort. That's Part B. There's a deductible that changes every year. Medicare changes it. It's about $226 this year. It's going to go mostly up, but sometimes they've gone down year over year. But anyway, that's your exposure. Part B deductible. Plan G pays practically, or pays everything that Medicare doesn't cover except the Part B deductible. So Medicare, being an annual year program, starts January 1st to December 31st. So when you go see your doctor at the first of the year, January, February, March, the first $226 you spend will come out of your pocket. You will pay that straight up out of pocket. After you've met that Part B deductible, then for the rest of the year, you'll have no more out-of-pocket costs for Medicare approved procedures or doctor visits or whatever it is. Okay, so that's a pretty good plan. Plan G pays everything for your health care, not including drugs, except for the Part B premium. Now, one other plan, Plan N. Plan N is in November. Plan N is going to do everything that G does, except there will also be up to a $20 copay for doctor visits and up to $50 copay for an emergency room visit when you're not admitted to the hospital. Okay, so up to $20 copay to see a doctor. Most of my clients report that copay is in the neighborhood of around $15, but the rule says it would never be more than $10. Also, if you go to the emergency room and you're not admitted to the hospital, then that's up to a $50 copay. Otherwise, that's your total exposure. The Part B deductible, just like Plan G, but in addition to that, with Plan M, up to a $20 copay, and then up to $20 copay for doctor visits, up to a $50 copay for emergency room visits. Out of all these 10 plans I told you about, in 15 years, I've only sold 3 of them, and that's Plan F, Plan G, and Plan N. Some of these other plans, I'm not saying that they're bad plans, because Medicare has them there for a reason, and some of these have been around for a long time. Plan A, B, C, D, those plans have been around for a while. There's also some plans that have been around in years past that are no longer even offered, like Plan J, and there's some other plans in there that really don't matter, but you can't get those anymore. And there may be new expansions of new plans, but I doubt it. These plans are pretty solid. I think they're going to be here for a while. It's also noteworthy in some states, including South Carolina, North Carolina, there are what are called high deductible plans. So like high deductible Plan F, high deductible Plan G. So what that means is these plans are going to do just like they promise. If you're born before January 1st, 55, and you have a high deductible Plan F, it's going to perform just like Plan F after you meet that high deductible. And that high deductible is going to be around $2,700. It changes every year, but about $2,700 once you've spent $2,700, then that plan is going to perform just like the original Plan F. Same way with Plan G. You're going to have the $2,700, but it's going to be a high deductible Plan G. You pay that deductible, then it's going to start acting like Plan G does. So some people find those beneficial. The premiums for those high deductible plans are naturally significantly lower than the premiums for the regular plans, but that pretty much covers that. Now, another thing noteworthy about Medicare Supplements is, except when you're first turning 65 and going on a Medicare, you're in an open enrollment period, or some similar situation like that, a guaranteed issue period if you're leaving employer-sponsored coverage, or you're new to Medicare, then you can get your Medicare supplement any one that you choose without proving insurability, or you would not have to answer any health questions on the application. Okay, so once you get past those scenarios, and you have, for whatever reason, want to make a change in your Medicare supplement, then you're going to have to apply. You're going to have to go through an application process, and that application process is going to have health questions on it. And they're going to be very specific health questions. There's quite a number of them. You're going to want to know your current health situation, the drugs you're taking, and answers to very specific questions about your health. Should you have any significant health problems, it's possible that you may not be able to change over from one Medicare supplement to another. It's just according to what company you're with and what your health conditions are. So it's not always guaranteed that as you get older and you're past age 65, and you may want to make a change on your Medicare supplement. Maybe you want to save some money on your premium, because remember, Medicare supplements are health insurance, so those premiums will go up year over year. We work with strong, highly rated companies, and we really want those companies, historically they do have a history, have a record of very stable premium increases. Okay, so all the companies that we work with at Trusteau and Stokes Farnham, they're stable, highly rated companies, and so generally speaking, those premium increases are low, stable, usually in the 3 to 5% range per year. So over time, though, those premiums will go up, And so remember, if you want to change your Medicare supplements as those premiums are going up, you really need to be in good health, not perfect health, but no kind of major health problems, because health problems can prevent you from changing over your Medicare supplements as you move forward. Now, Medicare supplements by law are not allowed to contain Medicare Part D prescription drug coverage. So if you have a Medicare supplement, it will not cover your drugs, so you'll have to have a separate standalone Part D Medicare supplement for drugs. A standalone Medicare Part D prescription drug plan that will cover your drugs, okay? And that will be in conjunction with your Medicare supplement. So Medicare supplements do not include drug plans. You would have to purchase that separately. The good news about drug plans is there are no health questions on the drug plans. So you're guaranteed to get that and make those changes every year. So, sounds like we have a lawnmower outside. We're going to bring this to a close today. And I really appreciate you being with us today. Please don't forget to subscribe and like our videos. Hit the notification bell so that whenever we have new videos coming out, you'll be notified. And if we can ever be of assistance to you with your Medicare needs, I'm Warren Alston. I am at the Stokes Farm office in Travelers Rest, but I can also be over at our Greer office on West Poinsett Street. So call us, go online to our websites at trustowens.com, stokesfarnham.com. And always remember, here at Trust Owens Stokes Farnham, we are here for you.